Well, let's talk about the Ebikambwe home care. So basically today we are talking about Toractin tablet. This Toractin tablet has a composition where each uncoated tablet contains cyproheptadine hydrochloride, which has a BP of 4 milligrams. Of course, this is anhydrous. To describe more about Toractin, Toractin tablet contains cyproheptadine hydrochloride, which is an carcinogenic agent. The mechanism of action: Toractin tablet contains cyproheptadine, which is a serotonin and histamine antagonistic and anticholinergic and sedative effects, and serotonergic and antihistamine drugs appear to compete with serotonin and histamine respectively for receptor sites. The pharmacokinetics: after a single oral dose of cyproheptadine hydrochloride as tablets, 2 to 20 milligrams of radioactivity was excreted in the stools. Only about 34 of the stool radioactivity was unchanged drug, corresponding to less than 5 to 7% of the dose. At least 40% of the administered radioactivity was excreted in the urine. No detectable amounts of unchanged drug were found in the urine of patients with chronic 12 to 20 milligrams daily doses. The principal metabolite found in human urine has been identified as quaternary ammonium glucuronide, conjugate of cyproheptadine. Elimination diminished in renal insufficiency. Indications: Toractin is mainly indicated as an appetite stimulant, perennial and seasonal allergic rhinitis, vasomotor rhinitis, allergic conjunctivitis, inherent allergens and foods, mild and complicated allergic skin manifestations of urticaria and angioedema, amelioration of allergic reactions to blood or plasma, dermatographism as therapy for analgesic reasons adjunctive to epinephrine, and other standard measures after the acute manifestations have been controlled. Dosage and administration should be individualized according to the needs of the response of the patient. Each tablet contains 4 milligrams of cyproheptadine hydrochloride. Pediatrics aged 2 to 6 years. The total daily dosage of pediatric may be calculated on the basis of body weight or body area using approximately 0.25 grams per kilogram per day or 8 milligrams per square meter of body surface, 3 milligrams per square meter. The usual dose is 2 milligrams, as in half a tablet, 2 or 3 times a day, adjusted as necessary as the response of the patient is monitored. The dose is not to exceed 16 milligrams a day. Aged to 7 to 14 years, the usual dose is 4 milligrams tablet, 2 or 3 times a day, adjusted to the necessary analysis of the response of the patient. The dose is not to exceed 16 milligrams a day. Adults A total daily dose for adults should not exceed 0.5 milligrams per kilogram per day. The therapeutic range is 4 to 20 milligrams a day, with the majority of the patients requiring 12 to 16 milligrams a day. An occupational patient may require as much as 32 milligrams a day. For adequate relief, it is suggested that the dosage initiated with 4 milligrams, which is 1 tablet, 3 times a day, and adjusted according to the size and response of the patient. Contraindications: newborn and premature infants. The drug should not be administered in newborn and premature infants. Nursing mothers, because of the high risk of antihistamines for infants generally and newborns in the prematures in particular, antihistamine therapy is contraindicated in nursing mothers and also those hypersensitive to histamines. Precautions: dizziness or drowsiness. Monitor the patient for drowsiness and dizziness and hold therapy in case.
Precautions: Toractin may bring about dizziness or drowsiness, and
Drug interactions:
alcohol, CNS, depressants may cause CNS depressant effects, and progenitor effects of cyproheptadine may increase. Serotonin uptake inhibitors, e.g. fluoxetine. Effects of serotonin reuptake inhibitors may be reversed.
Side effects: excessive perspiration, photosensitivity, rash, urticaria. Storage: store below 25 degrees in a cool, dry, dark place. Keep out of reach of children. Thank you for use of a registered medical practitioner or hospital in the laboratory. Yes.